Hello, I'm Dr. Vrishali Patil. I am the Program Director and Head of the Department for Multi-Organ Transplant Surgery at DPU Super Speciality Hospital, Pimpri, Pune. I was asked my opinion about redefining organ donation and transplant. An important aspect because transplant, though is a life-saving, but it's a costly affair and it has limited resources for organ donation. Looking at how we have moved from the start of organ donation and transplantation since 1940s in the world to what we are now, we still have too many patients on the wait list for transplant, and many of them still don't get transplants and die. The way our hospital or the way we look at redefining transplants and organ donation is that one is that organ donation occurs from patients or people who are like us, who are in the community, right? So we see more and more elderly patients. We see people with some kind of problems like hypertension or some other disorders or have had COVID in the past. So somewhere there is some compromise in the organ functionality. Does that mean that these organs are not suitable for transplant? They are. The way we can help is by redefining, by using methods where we can optimize the organs for transplantation. At our hospital, we see the maximum organ donation rate, and the reason behind that is we have an excellent critical care and coordination department where we have found out that what is the reason why patients are unwilling for organ donation is because of the knowledge gap or information gap that people or families have and the myths about organ donation. What we try to do is we remove these misconceptions about organ donation, try to give them a good comprehensive information about organ donation, explain them to the process because most of them are intimidated or have different concepts about what organ donation surgery is involved. They think about it's like a morbid affair. When we explain to them the way the organ donation process and surgery is handled and is done, and the final impact on the lives that are saved, that makes a huge change in the way they perceive and the way they decide about organ donation. And therefore, we see more patients saying yes for organ donation, and that is the need of the hour. Secondly, when we look at organ donation and transplant, at one point in the past, it was all about survival. But nowadays, it's more about improving the quality of life also. It is survival has extended to about 70% to 5-year survival in majority of the organs, especially the abdominal organs. And it's not about survival only. We want patients to live a better life, a healthy life, and be able to live as normal a life as possible. To do that, how have we changed as a transplant community, as a center that I work in? So we have redefined the way we have organ donations done. We have redefined the way the organs are transported or preserved. For example, just recently we airlifted an organ from Parbhani, which is about 8 to 10 hours away from Pune, or we airlifted a heart and lung from Mumbai within a very short span of time. So we have charter flights, we have organizations which help us in minimizing the cost in arranging these flights. We have the Maharashtra Police or the Indian Police which help us in arranging green corridors so that organs are transported to the transplant center in a very short span of time. Similarly, how do we change our methods of organ remaining viable until the organs are transplanted? We have partnered, or many hospitals have done it. So at our hospital, we have partnered with the organ recovery system, where we put the organs on machine pumps so the organs remain completely viable and we can make decisions whether this organ is good for transplantation even just before the organs are implanted. So using methods and techniques which enhance the quality of the organ also helps in improving the outcomes for the patient. In changing the methods, the way we operate, using robotic technology for liver transplantation, using methods, the way we can shorten the time of the operation, reduce the complication and morbidities. That is what the surgical teams and the doctors are always trying their best efforts to enhance that. In terms of making sure that the patients lead a better quality of life, it's not just about having a good operation and then it's done. It's also all about self-management skills by the patient. Because these are major organs with immunosuppression, it is important that the caregiver and the patient understand the importance of compliance of medication. As it is, for example, in India with a population of 1.5 billion population, the number of organ transplants that occurred, both living and deceased donor in India, were only 18,000 in 2023. If you see in Maharashtra, the total number of patients on wait lists are within Maharashtra, just one state is 20,000. If you look at the whole span of the country, there will be at least about 1 lakh patients minimum who are waiting for transplantation. And if we are able to perform only 18,000 or approximately 20,000 transplants, including living donor and deceased donor, you can see how many patients are unable to live a better life or have survived their illnesses. So now looking at that picture, the patients who get transplants are precious organs, right? So it is important that they sustain their organs, and therefore the goal is achieved that they are able to live a better life. But we also see as doctors that some of the patients are unable to maintain a better life because of poor compliance. Therefore, they have lack of finances or funds to maintain to buy drugs to maintain their organs. Secondly, they tend to relapse to their older activities, which hampered their quality of life. So at our hospital, most of the transplant and other transplant centers also, I'm sure, the transplant doctors and the social coordinators and assistants, we try to give the education and ensure there's compliance by the patient. We improve the cognitive awareness about organ transplantation, how to maintain their lives, how to ensure that the drugs are taken at the right amount of time, what are the side effects of the drugs, what happens if the medications are not taken, how do we arrange funds by using crowdfunding or partnering with NGOs so that the patients do not skip their medication. So transplantation is the way once a transplant is done, the life changes. So it is important that they, if they follow the protocol, if they have a proper compliance with the medications, then there is a minimum or less risk of the organs being rejected. So it is important that they continue that. I think we all have heard about how do we increase organ donation is by registering for or saying yes for organ donation. I think it is also important that if you want to do organ donation, talk to your family. So having that conversation is important. More than registering, talk to your family, explain to them what your wishes are, and therefore we'll have more organ donations, we'll have more transplantation, and we'll have more citizens living a better life.